As the world continues its battle against COVID-19, we see that the healthcare system in different countries is being challenged right now. COVID-19 cases continue to rise up and reach more than 19 million. It has claimed the lives of more than 700,000. It may be an uphill battle, but it is not yet a lost one, because more than 12 million people have already recovered worldwide, proving that we can win this war against this deadly virus. Although we may have not seen yet the peak of this pandemic, still, there are people who continue to join this fight and face this dreadful coronavirus every day of their lives. One of them is Hamad Akil.
My name is Hamad Akil, and I'm a physiotherapist here at Sunnybrook Health Sciences Center. The main reason why I wanted to become a physiotherapist was to allow patients to take ownership of their health through movement, through exercise, and giving them that ownership in terms of, I have the ability to get myself stronger by sitting up, by walking, by taking it day by day and slowly recovering.
When this pandemic came, Hamad did not hesitate to handle patients with COVID-19.
The reason why I initially volunteered was simply because I wanted to be there for the patients. But for me, I find a lot of meaning in seeing patients progress and regain their function over time. And I felt like I had the appropriate skill set for the position.
And Hamad is just a human that can feel the anxiety in facing infectious diseases.
It is quite challenging to be in an environment where COVID is present on a day-to-day basis. I think the biggest resource is having a supportive team that is collaborating with each other and looking out for each other in terms of the patient care, protecting ourselves, and supporting each other, not only from a clinical point of view, but also an emotional point of view.
It is paramount to him that every day he provides the appropriate care for the patients, despite the threat of COVID-19.
A typical day on the unit would start with the safety huddle, which would involve all the team members, and we would go through important updates at the beginning of the day. Then after that, we would start planning our treatments for the day after reviewing our patients. So what that looks like for me normally is helping people get stronger, whether that means, getting them up from breathing machine at the edge of the bed, or walking within the room with walkers, or working on some breathing exercises, helping them cough up mucus, get their lungs stronger. That's kind of how it looks like.
Others consider frontliners like Hamad as modern-day heroes.
I don't think I'm a hero in any sense. I think that this is what I've always wanted to do in terms of providing care for patients, helping them get stronger and recover. I do think it's especially challenging given the circumstances right now that we're facing. This is what I've wanted to do before COVID, and it's what I still want to focus on, is providing care for patients and helping them get stronger and healthier.
And Hamad has a message to all the frontliners around the world who put their lives in harm's way every day.
It's very important to look after yourselves and your mental health. And I think that as healthcare workers, we're often very giving and empathetic, and we want to do as much as we can for our patients. And in that process, sometimes we can lose sight of keeping ourselves healthy. And I think it's really important, not only for the patients, but for yourself in general, to focus on self-care and using your resources, making sure you feel supported, and making sure that you have people and things to go to if you do feel like you're stressed or worried.